Good evening, everyone, and welcome to tonight's session on getting the most from your medical appointments. I'm Bethan, I'm from Fertility Network UK, and I'm absolutely delighted to be joined tonight by Debbie and Dee from the wonderful organisation, the Fair Treatment for the Women for Wales, Emma, who like me is from Fertility Network Wales, Angela from Llais, Your Voice in Social Care, and also we're joined by Laura, and Laura's a hormone and mindset coach. Welcome all. They'll each introduce themselves a bit later on and their organisations, but just quickly, if I can just run through some housekeeping rules. So before we start this webinar, it is being recorded and you'll be able to access it on our YouTube channel, which will go on the webinar page on our website, probably in about the next week or so. If you want to watch any of this back again, or maybe you might want to share it with family members or friends so they can also heed the advice given tonight. If you'd like to ask a question during the webinar, just pop it in the Q&A box and we'll get through as many as we can. Although the webinar is recorded, we won't read out the names, so you can ask questions completely anonymously. With regards to how the session will run then, so we'll first come to the Fertility Network UK, followed by the Fair Treatment for the Women of Wales, and they'll both sort of outline the context, so who they are and what their members report to them are the challenges in clinical settings and medical appointments. We'll then go to Laura, who'll share the top tips and coaching for getting the most from your medical appointments. And lastly, we'll go to Llais, who will look at what to do if things don't go to plan. And then finally, we'll come to you, the Q&A, and this is your options to ask any questions to anyone here on the panel. So once again, welcome. And Emma, we're coming to you first.
Thank you. Thank you so much, Bethan. And a very warm welcome to everybody tonight for joining us this evening. I'm going to very quickly tell you, for those of you who don't know, Fertility Network UK, we are the nation's leading patient-focused fertility charity. And, we are the patient voice. We listen to you, we hear you, and we are here for you, for anybody who's on a fertility journey at any stage. At all. So why are we here tonight? Why are we here tonight? Going through fertility investigations or treatment of any kind, it's a very difficult process. It is hugely emotional. It is very regularly, the term very regularly used is it's an emotional roller coaster, and is made so much worse when things don't go the way you'd hoped. It is really difficult, we recognise how difficult it is to be able to challenge sometimes healthcare providers, when it comes to questions that you may have or requests in relation to your health. And so, we want to ask so many questions as fertility patients, but sometimes we feel really reluctant or quite afraid, to do that. So we are here. We're here tonight because of you. We're here because we hear you, we have listened to your experiences, we talk to you, day in, day out, and we've had so many conversations with patients that we support, so that telling us that they are afraid, to challenge, after waiting so very long for these appointments. People are telling us that they feel genuinely fearful that they could maybe lose the IVF entitlement or the treatment that they've waited so very long for, and that every hope is pinned on, or be negatively impacted. Therefore, as a result of that, they don't necessarily question, or even when they have, even when they've been treated, unfairly. And that's something that we are really, really keen to sort of support you with tonight, and which is why we've brought everybody together. We know that all patients are experts in their own right. We all know our bodies really, really well, our health. And we know it, but I think even more so sometimes for a fertility patient, due to that deep emotional impact that a fertility journey brings and has on a person. And I'm a type 1 diabetic and a fertility patient, and I'm an expert in both. I absolutely deem myself as an expert in both of those conditions, but I very much took much more of a focus and a lead, when it came to my fertility, the diagnoses and the treatments that were possibly available to me. And I was I wanted to be much more forceful and to have those conversations with my doctors more in relation to those treatments that I would like, that I wanted to just the protocols and just the ways, in terms of meds and so forth. And we recognise that, and we also recognise and we know that fertility patients talk to each other, they compare protocols, I did it, we've all done it, and that they learn from each other. So they are very educated and understand a huge amount about fertility. So when they do have that confidence then to question anything, sometimes they do tell us that those questions can be quite dismissive. So that's something that we want to provide some support with tonight. So we got together with Dee and Deb at FTWW. Thank you, all so much. And we were having this conversation, and yet again it came back to this very conversation about what I've just outlined. And we said, we just got to do something. Let's get a webinar set up where we can just let everybody know what their options are when things don't go to plan. What can you do? A little bit of confidence building and maybe some empowering in relation to how to get the best out of that medical appointment. So here we are here. I'm absolutely thrilled to be here tonight, and I really hope that everybody on this call this evening gets what they're hoping to get out of it. Please ask the questions, as Bethan said. We're here to be able to answer as many as we can, but you are also absolutely welcome to email any of us after and have that conversation one-on-one too. We're here for you. It doesn't stop with this webinar. Come to us, come and see us, have that conversation, and we're here to support you in any way that we can. You don't want to hear me anymore. You're here to listen to these incredible people on this call. So on that note, I'm going to hand back over to Bethan and leave you all to it. And so I'm really excited to hear, to listen to everything that everybody's got to say tonight. So huge thanks. Diolch o galon I chi gyd.
Thank you, Emma. Next up, we have Dee and Debbie, and they're from the Fair Treatment for the Women of Wales. Welcome both.
Thank you, diolch noswaith dda pawb. Good evening, everyone. My name's Dee. My pronouns are she, her, and I'm the engagement officer at Fair Treatment for the Women of Wales. I've got like pink purple hair mid-length down to my shoulders, and I'm wearing a cowgirl print dress, which is my favourite dress in the world. And I will be reading from a bit of a script, which I hope everyone won't mind with, and thank you all for your patience. I have immense brain fog today, so if I stumble, thank you. And would you mind sharing our slides, please? We just sort of wanted to tell you who we are, because some of you may not have ever heard of FTWW. So I'll just wait for to start that one. There we go. Thank you so much. So yeah, we are a patient-led women's health equality charity, and we're a disabled people's organisation, and we support, advocate and empower women and people assigned female at birth across Wales who are disabled and or living with chronic or recurrent health conditions. If you could go to the next slide, please, that'd be great. So I wanted to tell you all a little bit about what we do, because if this is your first encounter of us, you might be thinking, what on earth? But we were established in 2014 when our founder set up a Facebook group on the back of her own health issues navigating healthcare in Wales. Our small group of around 200 members grew and grew, and in 2020 we became a registered charity. Our main aim is to amplify patient voices and to give members the confidence and opportunities to have their say in clinical, ministerial and wider political settings. So we now have around 1,800 members. Some dip in and out, some get the information and advice they need and leave once they feel their issue is resolved. And others stick around, and many become volunteers. And we offer volunteering with a difference. Whereas many organisations demand commitments from volunteers, our volunteers are empowered to give as little or as much time as they want to and are able to. We also believe that volunteering is carried out in many ways. A member might be a case study for a media story, take part in a focus group, or sit on an advisory group. Some of our members even speak at events or lead their own campaigns and produce reports. We raise women's voices locally, one prime example being at our Gynae Voices Forum in North Wales, which is co-chaired with the Betsy Cadwallader Health Board and offers members the opportunity to have their voices heard. Just one outcome from this forum was that a North Wales fertility task and finish group had patient representation, ensuring that patients who needed to access services could access relevant pathways. We also raise women's voices nationally. 2 FTWW members are currently sitting on an All Wales Sexual and Reproductive Health Task and Finish group, and the work of the Menopause Task and Finish group, which also had 2 members representing patients, published its recommendations earlier this year. In ministerial spaces, a number of our members sit on the Welsh Government's Disability Rights Task Force working groups. And yeah, we do all sorts of things like that. We also provide bilingual resources to health, work and education settings, and we have published now a number of reports making the campaign for better endometriosis, recurrent pregnancy loss, menopause and autoimmune care here in Wales. These reports and their recommendations have come from patients with lived experience and expertise and are helping to change the landscape of female health in Wales. We campaign in a number of areas now, including successfully campaigning for mandatory menstrual wellbeing education to be added to the Welsh curriculum. And we just deliver a wide range of training and talks on female health issues in education, work and health spaces, as well as at events. We also join forces with other charities, so for things like what we're doing tonight, but charities and organisations to again amplify patients' voices. And we co-chair the Women's Health Wales Coalition, and I'm now going to pass over to my colleague Debbie as she will explain more about that. Thank you. Next slide, please, Em.
Thanks, and thank you very much, Dee. So good evening, everybody. I'm Debbie. My pronouns are she, her, and I'm the founder and policy director at FTWW. I'm a white woman with fair hair and specs, and this evening I'm wearing a pink top. So as Dee has outlined already, FTWW's mission is to empower our members and the wider population to have their voices heard and their healthcare needs understood, both on an individual basis in their medical appointments and in all areas of life, and also collectively when it comes to investment in the research and services women need to live their best lives. It was with all of this in mind that around 2 years ago now, FTWW joined forces with the British Heart Foundation Cymru to bring together a Women's Health Wales third sector coalition, with the aim of providing the Welsh Government with enough evidence to commit to a women's health plan, one that would see our experiences and health needs prioritised in Wales. So as you might be able to see on the slide, lots of little logos there, and they indicate that the coalition is made up of many different organisations, from royal colleges and clinical bodies to health condition specific charities and groups like our wonderful colleagues here this evening, Fertility Network UK Cymru, equality organisations, as well as academics and clinicians, and for us, perhaps just as, if not more importantly, patients with lived experience of various health conditions and the wider issues, prejudices and barriers that so many of us have unfortunately encountered in our healthcare journeys and lives. So during the course of the coalition's discussions, key themes emerged, and they are access to specialist services, training for health and care professionals, improved data collection and co-production. And by that, we mean where patients, their advocates and the groups representing them are enabled to have their voices heard and be equal partners in decision making, including in the design of health services so that they meet our needs. So underpinning all of those discussions and those themes was the widespread sense that women do not feel listened to when it comes to their symptoms and the impact of them. Often women report that their issues are normalised, that their pain, their fatigue, their discomfort are seen as perfectly okay and should be tolerated, that we should just be quiet and get on with it. This is something women tell us they encounter throughout their lives and in lots of different spaces. So with family, friends, in education, at work, in the media, and in healthcare settings, because let's face it, health services are just as much part of society as anyone and anything else. So the unconscious biases and barriers that people experience in life are likely going to be replicated in healthcare too. The result of all of this is that historically, women's health has not had the investment in research or service provision that it should. And if there isn't investment in these things, then female health issues will continue to be misunderstood and inadequately treated, and women will continue to feel, rightly so, that their voices and needs aren't being taken seriously. And all of this has to be addressed if our lives and health are going to be improved. I'm delighted to report that the coalition successfully made that case, and that the Welsh Government has now committed to co-producing a 10-year NHS Wales Women's and Girls Health Plan. The first stage of that process was to gather further evidence, and in November of last year, NHS Wales published its Discovery Report, which collated findings from a survey of almost 4,000 members of the public and patients across Wales. Unsurprisingly, perhaps, given everything that I've just described, the report showed that irrespective of the health conditions with which respondents were living, women's top priority was being listened to, particularly in their medical appointments. And it's for that reason that we're so pleased to be co-hosting tonight's webinar with the Fertility Network, where we hope you'll be able to get some suggestions and practical tips on how your experiences in healthcare settings and appointments might be improved. So that's it from me. Thank you very much for listening. I'm delighted to pass back to Bethan and then over to Laura for her expertise. So thanks very much all.
Thank you both. So next up, as Debbie's already sort of mentioned, is Laura, and Laura is a hormone and mindset coach. Welcome, Laura.
That's great, thank you. If you could share my slides, please. So, hi everyone. My name is Laura Teare-Jones. My pronouns are she, her. I have short brown hair and glasses, and I'm wearing a navy top. I'm a hormone and mindset coach from North Wales, and I live with a condition called PMDD, premenstrual dysphoric disorder. And I experienced appalling treatments and advice when I was on my fertility journey. And all of this has really been a catalyst for me in creating my podcast, My Hormones, My Health, and for the work that I now do in supporting and championing women with hormone and health issues. And I think we've already heard so much today about the amazing work that is going on. We've also just heard that there are many barriers to having effective medical appointments. And these barriers and what we experience can actually cause another barrier. And that barrier is going in there with a mindset that doesn't do us justice. Because we can go to an appointment often feeling anxious. We go in there already feeling unheard. We go in there feeling that the professional we're about to see is the enemy. And all of those feelings are valid, and usually from experience and from what we hear from our peers and from our friends and our family. But they're not always helpful in helping us to achieve the desired outcome. So what I would like to share with you, and next slide please, what I'm going to share with you today is a framework that I've used many a time personally, and also with people who I work with when they're approaching an appointment. I always say it's in the prep, and that's practically and also with a focus on mindset. So I tend to do this as a journaling activity, and I know there are a couple of people here tonight who know me and have worked with me before, so they're probably rolling their eyes thinking, oh my goodness, she's going to get us journaling again. But I would just really encourage you to have a journal or a pen and paper handy so that you can make some notes if you do have an upcoming appointment to prepare for. But if not, I think the slides are going to be shared after today, so you can have this slide as a bit of a something just to have in your toolkit as a bit of a resource to help you out with that mindset and being prepared for your appointments. And what I would say is you might not have the answers to all of these questions, and if that's the case, that's absolutely okay. You consider how helpful it could be to find out the answers to these questions in advance. So first of all, we're going to start with the why, and you might want to think about why this appointment is taking place. What's the point of it? How does it feed into your wider health? Is it about treatment, and is it about enhancing your health? Is it about prevention? Is this appointment something that's been arranged by yourself, or is it something that you've been referred or recommended for? Think about the why, because having your why is almost like that's going to be the overarching thing that's going to help you during that time with that mindset. But just take a moment to think, why is this appointment taking place? Why does it matter to me? And then we'll move on to the what. What are my goals and expectations for this appointment? Do I want to come away with a treatment pathway? Do I want to come away with a prescription in my hand? Am I hoping for a referral? A referral to who? Who do I need? And whilst we're focusing on the what, also consider what will happen during this appointment. Will I be examined, for example? What do I need to take with me, if anything? And at this point, you might like to write a little bit of a list as well. I love a good list. Journaling and lists, them, I think. And then we'll move on to where, and this one's actually really important because I think when we think about the where and where the appointment is taking place, most of the time that might feel really obvious, but do take the time to consider, is my appointment taking place in a doctor's surgery, a GP? Is it in the local community hospital down the road? Is it further afield? Is it a specialist hospital? If it's a ward, which ward? Transport, car parking, really think about your location. I'll put my hand up and say the amount of times I've gone to an appointment, and when I finally get in the room, I'm hot, I'm sweaty, and I'm bothered because I've been running late. And the danger is then that everything that you hope to get out of that appointment just goes out of the window because you struggle to concentrate, you can't get your breath back. So it's doing that planning and thinking about the where and the planning of the journey that can really help just get you into that mindset and keep you there. And then who am I seeing? Is it a GP? Is it a specialist? What's their area of expertise? And therefore, what training will they have? And remember, if they're a general practitioner, they're not a specialist. And that means that they might not have the specific training that you're thinking they do have. So just keep in mind that the particular person you're seeing may either be a general practitioner or a specialist with a specialism in a certain area. Also consider who is attending the appointment with you. Would an advocate be helpful? And you might feel like the answer to that is no, and that's absolutely fine. If you do want somebody to be at your appointment with you, who would you choose? Would it be someone like a partner, a sister, someone you know who's really great at being assertive? Would an advocate be helpful? And then we move on to the when. How long have I got for this appointment? And this is a biggie, isn't it? Yeah, the amount of times that I've gone to my GP and I've said, well, I've got my list, and they go, no, we don't have a list. So bearing in mind that your appointment could be 10 minutes, it could be 20 minutes. And based on that, what is the priority? If you do have a list, what order are you going to go through? Think about what's the most relevant, what's linked, what they'll already know, and what gaps you need to fill in. And how? How can I help a medical professional to help me? And when I ask that question, I speak from experience. When I got my PMDD diagnosis, I remember I took my journal to my appointment with me, and the only way to diagnose PMDD is by tracking your menstrual cycle. So I went along with my journal in hand, and it's that item that got me my diagnosis. So that to me was really valuable in that moment. However, last year I attended a patient coalition for IAPMD, and when speaking with GPs, they said, do not do that because we don't have the time to read through all your notes. And so it's about thinking, okay, well, what can I take here? Is it going to be a journal? Is it going to be bullet points? A lot of, there are some really great apps that you can use now to track symptoms, to track menstrual cycles in my case. And so they can be a little bit more succinct. So it's trying to find a way to communicate your needs, your symptoms, what your experiences are in a way that's succinct and efficient for your healthcare professional. So again, just think, is it helpful to take my notes on my journal or an app, or actually is it better to not do that? And every scenario will be different. And on the final point of how, also consider, how do I want to feel after my appointments? Do you want to feel like you're on the right track? Do you want to feel that you've been listened to? Do you want to feel like finally there's an answer? And if so, the next question I would ask is, what's the best thing that I can do for myself to increase my chances of feeling this way? And then finally, after your appointment, do take some time to reflect on how satisfied you are with how it went and what your options are now going forward. I hope you've found that helpful. If you have took notes or got your journal out, then that's absolutely brilliant. But that's all for me, so I'll hand you back over. Thank you very much.
Thank you, Laura. And our next and final speaker is Angela, and Angela is from Llais, Your Voice in Health and Social Care. Welcome, Angela.
Hi, thank you. Hi, so my name is Angela Mutlow. I'm the Strategic Director of Corporate Services and Operations in Llais. So Llais became operational on the 1st of April 2023. We are there to support people in Wales in health and social care matters. We were previously called Community Health Councils, and we were set up in 1974. But Community Health Councils only had a remit in health, and now we cover both health and social care. So we've got a much wider remit. So obviously, lots of health and social care conditions, they interlink these days. So Welsh Government felt it was much better, and we are delighted to be bigger and better. So we're a Welsh Government sponsored body that's independent. We believe we're trustworthy and an inclusive organisation. We believe in a healthier Wales where people get the health and social care services that they need in a way that works best for them. And that's what's really important, what's best for you. Our vision is to raise the power and influences of people's voices in shaping health and social care services in Wales. We have three main functions. So our first function is engaging with as many people as we can in Wales. We want to hear what's working well, and that's important about what's working well as well, and what's not working well, so we can make sure that those in authority can hear those voices and take action to improve services or give staff congratulations on delivering such an excellent service. It's important for colleagues to hear the good and the bad, isn't it? Our second remit is making representations. That's a legal term. What that means is basically we can ask any authority any question we see fit. So if we are picking up some concerns in a particular area, we can go to that particular authority and ask the questions around that to ask for, it's kind of a scrutinising function there. And then we have a complaints advocacy service. So we're able to support people to make a formal complaint in relation to the services they've received within health or social care. But also what our advocacy service does is helps people to have questions answered. So a common one we receive is, I was referred some time ago by my GP. I haven't heard anything. I feel like I've slipped into that black hole of the referral bank. So we're able to contact the health board or local authority and find out where your referral is in the system. So that's our three main functions. We have around 100 members of staff, and we are looking to recruit more, which is a really exciting opportunity. And we have around 150 volunteers, and we are always looking to recruit more volunteers. If anybody's in touch today, please let the Fertility Network know, because we're always looking for volunteers. We have offices right across Wales. We have 12 offices in total, so we are primarily attached to in the local health board footprint. So if you think in Cardiff, we have one in Llais in Cardiff, in the Gwent area, the base is in Cwmbran. So the most common things we hear, and that is in relation to health and social care, about people's access to care and treatment and communication. I think all the themes that we look at throughout the year, they always come down to access and communication. We often hear from people that they don't want to make a formal complaint, but they do want authorities to listen, and they want services to be improved. And there are lots of ways we can do this, and one of those is a patient story. So that way you can remain anonymous, but you can tell us your story about what happened to you, the good and the bad, and we can filter that back to the service that you received treatment for, so they can learn from that. I'm here today to listen to you and hopefully be able to support you in any way we can. I can see the questions starting to come in on the chat, and I'm certainly able to help with the one that's been put in there about what do I do about cancelled operations. So if that's okay, I'll leave it there, and then over to you to ask your questions. Thank you.
Thank you, Angela. So as mentioned, if people can pop their questions in the Q&A function as opposed to the chat, that would be fabulous. But they are starting to come through. So I'll start with question 1, which is, I've had repeated cancellation and postponed appointment letters. Why does it always say unforeseen circumstances? The appointments are so important to me and life-changing. I would like to know what the unforeseen circumstances are. I literally had an appointment tomorrow and had it cancelled last Friday. I ran out of my meds, which only the hospital doctor can prescribe. I can't get hold of the secretary. I've left a voicemail. I have endometriosis, so having these meds are really important. I just can't accept this, and I'm more than fed up. I also took a day off work for this appointment, so that is just so annoying in so many ways. Angela?
Hi, yes, if I can come back into that one. So you're right. Appointments get cancelled all the time. I think what's important is when there's a pattern of appointments being cancelled all the time. I think that's when we need to look at and ask some questions. I think the why appointments get cancelled, well, there's an array of things: staff sickness, annual leave, IT failures, consultant got stuck in traffic on the way. When they say unforeseen circumstances, they mean a big wide of complications that have come in, which means that unfortunately your appointment needs to be cancelled. I recognise the running out of medication. We hear that a lot. And we also hear a lot about the pattern of cancelled operations. So you've said that you've booked leave, which has an added complication, doesn't it? And it's repeated. So what I would suggest is that you get in touch. If I could find out, or if you could let the Fertility Network know where you are, we can provide you with a telephone number for your local office in your area. What they can do is, we also hear lots of times with people that they ring in the secretary and the secretary's not answering the phone. We can take that away from you. So we can make those calls for you, but we wouldn't necessarily go to the secretary. We would go to the people higher up, so to make sure that they listen, and we can take that stress away from you. And what we can also do is make sure that the person, that we speak to recognizes, well, actually, this has happened a number of times now. This isn't just one appointment that's been cancelled and it's a pain. This is a pattern. And we see that in cancelled operations quite regularly, actually. So it's important that A, you get your medication you need. 2, the authority that you see in you recognizes this is a pattern, and this is really having a detrimental effect on your health. And see really that you get the answers that you need. So I would say to you, please get in touch, and we can give you our local contact office telephone number, and they will be able to support you. I hope that helps.
Thank you, Angela. We've got the information, so I'll be sure to pass that over. Did anybody else have anything further to add, or are we happy to go to the next question? Yeah, lovely. Okie dokie. So next question. Who do we need to contact about not receiving a letter when referred is an urgency and not heard anything? I'm really struggling but can't get hold of anyone as I'm really struggling with pain but not being listened to. Angela, thank you.
So I'm really chopsy today, aren't I? Yes, so that is something we can help you with again. Please contact the Fertility Network, let us have your details. We can give you the regional office's telephone number in your area and we can make contact for you. We are there to be the voice of the patients in Wales. So if you live in Wales, we can certainly help you in any way we can. And if you're having problems with your appointments or any help that you need, then we can step in there and help and take some of the stress away from you.
Thank you. Debbie.
Yeah, so just to say as well, if the people that are sending in the questions there are in Wales and you feel like you want some sort of peer support, please do reach out to FTWW. You can look us up on Facebook, and essentially that forum is operational 24 hours a day, 7 days a week. And I think has been said here tonight, you're absolutely not alone, unfortunately. And you'll always find a kind of listening ear in that space, who may well sort of be able to share some sort of wisdom and just, as I say, a bit of peer support, and that can often be invaluable, I think. And I think probably one thing that I'm going to flag up, and because Dee often sort of really sort of articulates this so well, is that Llais are here tonight and they're an absolutely amazing organisation and can really help with sort of one-to-one advocacy and getting your voice heard. But another avenue as well is to consider writing to your MS, your member of the Senedd, or making an appointment with them to have a chat in what's called their surgery. And they can often raise not only your voice, but just like Llais, sort of amplify those voices, especially if they're hearing from lots of people who are experiencing the same problems. And often we have meetings with Senedd members and they say to us, well, we're not hearing any of these stories. This is news to us. So, remember, they are there to be your elected representative. So do take advantage of that and make sure they know what's going on. Sometimes, if they're hearing lots of these issues, they are perfectly happy to go to the Senedd plenary session and, really, as I say, amplify those voices. And it's because of that we're now getting a women's health plan, because they were hearing from so many of us across Wales that this needed to happen, that it was a priority. So do that as well if you can. But yeah, thank you. That's it from me for now.
Thank you, Debbie. Next question then. I've been told I need rehabilitation by a respiratory consultant after multiple hospitalizations over winter. I'm too poorly for the community scheme criteria according to practice nurse at the GP. Referred back to the consultant, have been told the hospital-based pulmonary rehab program has over a 2-year wait. What do I do in the meantime? Angela, thank you.
Yeah, so thank you. So I think this is the pandemic. Pandemic is hugely responsible for the long waiting list, and it's really, really sad to see. We are seeing health boards utilising private facilities, obviously through, so you're able to access treatment there. I think what I would say is, if you're being told that you've been referred for an area and the waiting list is excessive, 2 years is excessive when you're in pain, then I will go back to your GP. Your GP can escalate it for you. If you contact us, we're not able to escalate it for you, but we can look into what's happened. Sometimes you could have fallen in between the cracks and you're at, I dare to say it, but sometimes people's applications, they go astray. So what we can do is make sure you're on that list. We can find out whether you're urgent or routine. Sometimes, very often, you'll be as urgent, but you're logged down as routine. I'd be shocked if an urgent was waiting 2 years, but if you are in pain and that 2 years is just absolutely daunting for you, go back to your GP. And if your GP tells you you're urgent and you're being told you have to wait 2 years for urgent, please, please, please get in touch with us, because that is unacceptable.
Thank you. And just for those on the call, I've popped my email address for those that don't have it in the chat. So please do take that down for any of these sort of referrals into the team at Llais. Dee, thank you.
Just to add on to Angela's sort of comment there and what Debbie said before, I think this is a primary example of a really, it's horrible to say a good example when we're talking about our health and things that aren't going well, but that is something that your member of the Senate needs to hear about, because we've found in the past that sometimes that, as Debbie said, they're just not aware of what's going on, because what official channels might be saying are obviously different to what we're experiencing. And this, you know, this is everything that we find in the work that we do, you know, what we're reporting. And sometimes a service or an MS or somebody who's in, you know, that official channel will be going, oh yeah, everything's great. And we're there going, like, waving a flag going, hello, no, there's an issue. So I think, yeah, it doesn't necessarily have to be your local MS. It could be a regional MS. And sometimes we say to people that, for example, if your local MS was the health minister, you might not get a response very quickly, but actually look at your regional MSs as well, because they're, you know, often from different political parties, which may work in your favour in terms of putting pressure on, but also may just have that lighter caseload, so they can take that on for you. And I think, without going around the houses too much, particularly with different services that are being set up now as we come out of COVID. So, for example, like pulmonary stuff sometimes is fitting under long COVID services or ME services. And again, what we're seeing is that a lot of areas will have a postcode lottery. Might have a service in Naira, Bevan, or in Betsy that you haven't got in Hywel, for example. So that's again where you can start trying to put that pressure on to get referred into that appropriate service. But yeah, please talk to Angela and team at Llais. You can contact the health board, but absolutely this is a prime example of something to contact your MS about as well.
Thank you, Dee. And Angela, I've just got a quick question to add on to that, and that's obviously the purpose of this event tonight is for people living with Wales. It's our expertise, it's the footprints that we provide as charities, but I do know there are some people joining us from across the border in England. Can I just ask, who are your counterparts in England?
So the Patient Association in England will be able to help you. They're our counterpart, I suppose, if you want to call it that. So they'll be able to contact, you'll be able to do a bit of a Google search for them, and they'll be able to help you, hopefully in any way that they can.
Oh, lovely. Thank you, Angela. Next question then. Why can't the health board tell me how long I'm going to be waiting for surgery? I've been on the urgent list for over a year. I am unable to work for over 6 months, and I can't begin to plan a return date. Angela, thank you.
Hi. 12 months for an urgent surgery is just not acceptable, is it? It's not. When you're not able to work, it's not acceptable. So I would say, come to us and we'll help you in any way we can. If you didn't want to come to us, you wanted to do it yourself, then I would be contacting the consultant's PA, find out if you are listed as urgent or is it routine. Then go and speak to your doctor. If you're down as urgent, as routine rather than urgent, you're on the wrong pathway. So you need to go back to your doctors and speak to doctors and make sure that they escalate it. Being unable to work because you're in so much pain is just not a position anybody wants to be in. So go to your GP, ring the PA, or contact us and we'll do all that for you. But that's just not a position anyone would want to be in. So please reach out if you need to.
Thank you. Dee?
I think, again, Debbie would agree with me. This is probably one of the most common complaints that we hear is actually, you know, you can't expect, the powers that be cannot expect us to just sit at home on a waiting list. So it might be today, or I might get a letter today. We all do it, don't we, when we're waiting for treatment, you know, checking the post box multiple times a day. But it is an incredibly common complaint that we hear. And I just wanted to reassure the person asking that question and everyone on the call that that is something that Debbie and I have escalated in our Welsh Government meetings that we have now as part of that Women's Health Plan work. Because, like you said, how can you plan? How can you plan your life? How can you put your career on hold? You might not, we're here tonight to sort of focus primarily on fertility. What happens if you're waiting for a surgery that then you may not need additional fertility treatment for, which is the case for a lot of our members as well. So, yeah, I just kind of wanted to offer that reassurance in that that person's not alone, but also that we have amplified that very loudly and in no uncertain terms. I think for those of you who don't know us, we often sort of say that we're critical friends to Welsh Government and health boards, and sometimes we're more critical than friend, and that's something that we've really sort of put the pressure on, because you need to have at least an estimate of how long you're going to be waiting and not just being expected to wait and see.
Thanks, Dee. Debbie?
Thank you. Thanks, Bethan. Yeah, I mean, I yes, absolutely echo everything Dee was saying there. And I think it's also really, really important. We've spoken a lot about putting in concerns and complaints. And I think it's just so important that in any kind of dialogue you're having around, how you're struggling with your symptoms, sometimes it's so tempting when we're told, oh, just describe your symptoms, describe your pain and all of this. It's tempting to kind of focus upon sort of describing the kind of, trying to describe how that pain feels to us. But actually what's really important in terms of getting people to understand where you're at is to talk about the impact that that pain and those symptoms are having on your life. And that is a really, really important one, isn't it? To make sure that you say very loudly and very clearly, whenever and wherever you can, that this is the impact your pain is having on your life, in terms of you're not able to work, you've been out of work for X number of months, the impact that this is having on your, your finances, etc., etc. Because actually, sometimes those are the things that people can properly understand, and that really make them sit up and listen and do something about it. And the other thing I just wanted to touch upon really quickly is in terms of, if you are in work, and I hear the person that's written there saying that they're currently not in work because of their symptoms, but we also know of people that are still struggling to sort of stay in work because of their symptoms. And I think something that, we're very keen to kind of empower our members to appreciate and utilise is the Equality Act. And if you're living with a long-term health condition and all of the symptoms associated with that, then actually, under the equality law, you're entitled to describe yourself as a disabled person and, talk to your employer about having reasonable adjustments in the workplace. And that includes as well, so, if and when people have an operation or whatever, or a procedure associated with that health condition, that maybe they also have a phased return to work as well. We hear a lot of the time from our members, people who've had operations and then feel that, they have to go straight back into what sometimes are very physical jobs within literally a couple of weeks of having had that operation. And sometimes they can end up doing themselves more harm than good. So do not be afraid to have those, just as, we're talking about medical appointments, but equally in the workplace, don't be afraid to have those conversations about reasonable adjustments so that you are able to be your most productive for the longest possible time. And that benefits your employer as well. Thank you.
Thank you, Debbie. So the next question, I've
Sorry,
had,
Bethany.
oh, sorry, Em, I
I
didn't see your
couldn't
hand
find
up
how to
then.
put my hand up, so I had to put it up physically like this, look. I just wanted to come in there on the end of what Debbie mentioned in relation to the workplace support, and just to, you know, echo that us as a charity fertility network, we do provide support within the workplace, and we that's called Fertility in the Workplace. So what we can do is we do go into employers, and we provide managers and HR departments and staff with, whether it's lunch and learns, with some real awareness raising in relation to what it is to go through a fertility journey, how that may impact on your work, and how best an employer can support you going through that. So for any of you on this call tonight that may feel that that is appropriate and that might help you, please do get in touch. And, you know, you can send us an email, you know, for your HR advisor, and we can reach out to them. We do that. We've done it, and we've had some great success. And we work with a lot of organisations, South Wales Police, we work with Admiral, you know, all now who are really supporting people in the workplace who are struggling with their fertility. So please do remember that, and give me drop me or Bethan an email if you'd like to know a little bit more. So yeah.
Thank you, Emma. The next question is, I've had repeated experiences of being dismissed and patronised by medical professionals when I voice my needs and experiences from previous failed rounds of fertility treatment. I prepare in advance, and I'm calm and clear in my requests at the appointments, but I'm not being heard. What more can I do? What campaigns are happening to change the attitudes of doctors towards female patients? It can't just be us. They need to change too. Angela, thank you.
My advice would be make a formal complaint. If you're being treated in a patronising manner and you're not being listened to, then I would urge you to make a formal complaint. That's not appropriate. You shouldn't be treated like that. And that consultant needs to learn how to treat people in a better way, don't they? They've all been gone through university. They've all been trained on how to communicate with people. If that's the experience you're receiving, I would urge you to make a formal complaint. Or let us have the details, and you could remain anonymous, and we can make sure that the authority knows about it. Thank you.
Can I just ask a follow-on to this? Does that work for both private and NHS, Angela?
In health, it's only NHS. In social care, it's both private and NHS. But sometimes you might be receiving private treatment through the NHS as well, because, like I said, the waiting list is so long. You may have been referred through the health board. They might have a commissioning situation with a private provider to bring their waiting list down. So I would check.
Do you know what the advice would be if it was a private patient paying privately for themselves?
Then my advice to you then would be going direct to the provider and make a formal complaint in writing. And in that complaint, I would be requesting a receipt of your complaint, and then asking for an update or regular update. In the NHS, if you make a formal complaint, you should have an acknowledgement, and you should have a response in 30 days. It doesn't tend to be 30 days because of the investigations that's got to happen. But within that 30 days, you will get a contact from them saying, really, apologies, we are looking into your complaint. It's going to take a little bit longer. So what I would say is submit it, ask for confirmation receipt, and chase it if it's private.
Thank you, Angela. Debbie.
Thanks, Bethan. Yeah, so it's really interesting because, of course, you know, what Angela's describing there is, you know, what to do when it's happening to you as an individual, and she's absolutely right. But I think that the question was also asking about what kind of campaigning is taking place in this space, because, you know, as I outlined in my sort of first presentation, is that actually this is coming across as a widespread issue that's, you know, that's happening to so many individuals, particularly when it comes to women's health. And as I said again in the presentation, when the NHS Wales conducted its survey to find out what the priorities were for public and patients across Wales when it came to women's and female health, well, it was all about attitudes, being listened to and addressing those attitudinal problems. That really was a top priority, irrespective of the health conditions that those respondents were reporting. And I think what's really, really important is on the back of those findings, and on the back of all the discussions we've been having with the Welsh Government and NHS Wales around the resulting Women's Health Plan, was the commitment that the solutions that arise from that plan will be co-produced. So, that means that they have committed in writing to listening to what we are telling them, and then working together with clinicians and with healthcare providers to create the solutions to this. And one of those has to be with regard to training for health and care professionals, and that includes identifying and addressing unconscious biases, and I think that's what the questioner was asking about. So, certainly we envisage that part of what we'll all be doing as we develop that plan is having discussions with, for example, the Royal Colleges who design and deliver the curricula for your different healthcare professionals. And making sure that patients are absolutely front and centre in what those curricula include, and how our medical professionals are how they're assessed and evaluated. It all has to be co-produced if we're going to unpick and really properly proactively address these kind of widespread issues that are being asked about tonight. And again, in Wales, we also have a body called Health Education and Improvement Wales, and we're also in conversations with them as well around how we can make sure that when trainees are in healthcare settings, that it's not just about okay, what are the health boards or the healthcare providers telling us about how well they think things are going, but how far are we engaging with patients in terms of their experiences and their outcomes, so that we can make sure that our trainees of the future are delivering healthcare that really properly meets patients' needs. And that includes, sadly, as we've said, all of those attitudes. And I think it's fair to say, again, as I outlined in my presentation, our healthcare professionals are just part of society. So all of those sort of attitudes and issues that we encounter in life, with our friends and our family and, across the media, wider society, which says that, well, let's, for example, period pain, it's just normal, get on with it. We're all part of a society, and those attitudes need to be addressed much more widely, so that the trainees and healthcare professionals of the future are able to identify and address those problems and make sure that we get the best care that we can. Thank you.
Thank you, Debbie. Laura.
Thank you. So I just want to really echo what Angela said, and also I don't know if what I'm about to say will be helpful, but I do hope it will give just a sense of solidarity, if nothing else, because it's not acceptable. And I often find that these kinds of topics only seem to come up as we've just heard, when it comes to women's health. And I just wonder if we talk, I know this particular question is about failed rounds of fertility treatments, and I just wonder if we took the topic away for one moment and just put it to the side, and we explain that we'd had an appointment where we'd felt not listened to, we'd felt patronised and dismissed, what action we would take over that. And I think when it comes to a topic that is predominantly a women's health issue, or other topics that are women's health issues, we do tend to think, well, if I've been dismissed and I've been patronised, I don't know what I can do. Whereas if it was a health condition that affected 100% of the population, as opposed to only half, and by that I mean men and women, would we respond differently? And so I love that this person has said, I've prepared in advance, I'm calm and I'm clear in my requests, and that's perfect. It really is. And I would just say, if you're not getting the outcome that you feel like you deserve, then as Angela said, then absolutely take action on that, because it doesn't matter if it's relating to fertility or any other health issue. That's not how you should be treated when it comes to your health. I'll get off my soapbox now. I hope that was helpful.
Thank you, Laura. Emma.
Hi. So just for those of you who were referring to sort of fertility and related, please do come to speak to us to tell us about your experiences, because what we do here, in Fertility Network UK as a whole, we do work closely with healthcare professionals, through primary, secondary and tertiary care, and we want to hear about those experiences, and we can use those experiences anonymously within the presentations and the conversations that we're having, on a wider scale. So it's really important that you if you feel that you can, come and have that conversation with us, and we can, certainly look to feed that back. We do a lot of different training sessions, awareness sessions, we look at the far-reaching trauma, of fertility. So please do, bear that in mind, and do contact us and let us know, how it is that you're feeling, so that we can ensure that we include that going forward. Thanks, Bethan.
Thank you, Emma. Next question. I have to admit I'm rather exhausted with feeding back to my MS or MP, as they both said they were aware but nothing they could do. With multiple chronic health issues, I try to advocate as much as possible, but it is exhausting. Is there any advice as to how you manage this advocating for yourself fatigue? And I know, Dee, you've requested to answer this question, so I'm going to pull you in first. Thanks, Dee.
There we are. I couldn't unmute myself then. Thank you. Well, firstly, hard relate. I think all of us here who are living with different health issues as well really relate to this. And I also have lots of chronic health conditions, and one of those is ME. And so fatigue is my life. It dictates what I can and can't do. So first of all, we need to make sure that you're looking after yourself. And this isn't about, oh, let's do some self-care and have a bath, because bathing is essential care. It's not self-care. So self-care is, about, okay, what can I do? As Laura was saying, what can I do to put myself in the best position for this? If you're living with particularly fatigue, and when we say fatigue, it might be chronic fatigue as a symptom. It might be fatigue of feeling really exhausted with your health experiences and what's going on. It might be fatigue with day-to-day, just trying to get by work, looking after relatives, any of those kind of things. So we need to make sure that you're looking after yourself. And in terms of that, the very best thing that I have found to do for myself is pacing. And if you're a member of FTWW's group, in our group a while ago, we had a pacing masterclass delivered by a disabled occupational therapist. And that, I can tell you, like I booked that in for the rest of our members because it changed my life when I had it. So on paper, when you look at somebody living with ME, endo, fibro, all sorts of different things, we shouldn't really, the assumption would be that we can't do much. And I've completed an MA. I'm working part-time for FTWW. I'm able to go out and enjoy life, and it is because of pacing. But particularly addressing your MS in particular. So your MP will very likely say, health is devolved in Wales, so it's not something we look at. I still hound my MP about what's going on because I think they need to know. But this is where your sort of geography, if you like, with your local member of the Senedd. If you've been trying your local member of the Senedd, take this issue and any sort of complaint you've made and take it to one of the regional Senedd members. And it's sort of a little bit kind of playing dirty, but it's essentially saying, I went to my local MS, they're from that political party. And by default, by the way the political system works in Wales, if you've already tried your local MS, your regional MSs are not from the same political party. So we've actually found that with some of our members, is that they've gone to regional MS rather than a local MS, and they've actually been able then, as Debbie said, they've been able to have those questions asked in plenary, which is when you see everyone in the chamber sort of asking ministers questions and things like that. They're able to sort of fight that cause with you a little bit. They might be able to take it to the Health and Social Care Committee, who often put a lot of scrutiny and pressure really on the health and social care departments of Welsh Government. But yeah, I just sort of wanted to say, I think it's really important as well. This is where peer support comes in. Because if we feel like we're doing everything by ourselves and that we fit, because you're already feeling isolated, right? When you have chronic health conditions, and especially if the people around you might not understand those chronic health conditions, they might not know anyone who's got it, then this is where peer support comes in. So if you're looking at fertility journeys, like join those fertility network groups, join FTWW. And I think this is where I wanted to say we're a little bit different to a lot of condition specific support groups in that I've always joined. I mean, I've got, I think it's 5 chronic health conditions, and I've joined lots of different groups for these specific health conditions. And I am not being paid to say this, I promise you. This is coming from somebody who genuinely had her life saved by FTWW. The reason FTWW speaks to me and speaks to my heart is because there was that peer support. There was somewhere where I could go and say, I'm at the end of my tether and I don't know what to do. But also this is where our involvement opportunities come in. This is where we say, the Health and Social Care Committee want to come and talk to patients. This health board wants to come and talk to patients. This health board setting up a pelvic health pathway, and they want to hear from patients who are living in that area. And that's actually where you start feeling more empowered, because you're like, okay, I can be part of the change here. I can have my voice heard. We respond to consultations that are put out from Welsh Government, from different committees, from health boards and things like that. So we give you the opportunity and the tools to have your voice heard by responding individually or responding to us, and we collate everyone's responses. And these are actually really powerful. And that was what led to us being asked to give evidence to the Health and Social Care Committee last year. And again, this is part of what's led to a women's health plan. This hasn't been down to me and Debbie. This has been down to thousands of women across Wales and people assigned female at birth who have just gone, nah, enough is enough. Like we said before, we cannot just keep saying, oh, it's just how it is. I don't know about you. I'm very entitled. I'm a spoilt Leo, and I was the youngest of 4. So I'm not used to this sort of being told, no, you can't do that. I've always asked why not. And I think you ask why until you get to that, okay, we'll do it. But yeah, you're not alone. I know I've rambled for ages, but I really hope that's helpful, because I hope that me sharing sort of my experiences of what has helped me as well will help you too. But yeah, I will stop talking and let somebody else have.
I'm not sure anyone else wants to come in. I see no hands, so I'm going to go to the next question, which again, Dee will answer for us, hopefully. So, what is the best way to contact the member of Senedd? Email or attend their surgery, or what? When they ask, what do you want me to do? What do I say? I never saw an MS because I'm not sure what they can do. However, I see GP often because I know they have some power, and same with the specialist doctor's secretary. Thanks, Dee.
Okay, so I'll give you my own lived experience as an example. So I've never had any need for fertility services. Having children wasn't on my agenda, but I had a 23-year diagnostic delay for endometriosis, and actually it's that's caused my ME and my fibromyalgia, which are actually the toughest conditions that I live with currently. So I had gone through the NHS system twice. I'd had 2 laparoscopies and been told there's nothing there, you've got IBS, sent on my way. I'd had very traumatic appointments, and I wish I'd had a Laura back then that I could have, gone to and said, what on earth do I do? Because again, I felt really alone. But I think this is where, as we said before, with a member of the Senedd, their job is literally to work for you. they are elected by the people to support the people. We once had a conversation with a member of the Senedd who said, I will have, if there's a proposal to have a hen house put up in some, in a local area, I'll have 400 emails and letters of petition telling me no. And he said, I've never heard of endometriosis. I don't know what that is. So this is something that I think Debbie and I was told that, and we were like, right, this is why we always say to people, write to your MS, because if they don't know, they can't be putting pressure on the health, the health minister and the minister's departments and the health boards to improve services. If we don't have lots of us reporting to our MSs and saying, I've had a really bad experience and I don't feel at the moment that I've been heard, or I've had my voice heard, I've felt patronised, it's their job to sort of help us. And I think in terms of asking what they can do for us, it's actually, what would you like to do for them? So I think go to Laura's amazing who, what, where, why, when, how, and look at that. What I actually did was sent a very big complaint email, because I don't do phone calls because of my ME and I'm neurodivergent, so I can't cope really well on the phone. So I wrote an email and I told the health board in my complaint that I would be forwarding it over to my MS and to my MP, and also to what was my community health council then. So what I actually did was essentially told my MS my story, my experiences. So they had a copy of my complaint, and my MS was great. I've got to say, John Griffiths in Newport East, he offered to meet with me. So I went into his office and had a chat with him, and basically was able to sort of raise that flag, as I said before, about this is happening to women all over Wales. This isn't just a one-off, this is happening a lot. I always say, Debbie will be sick to the back teeth of hearing me say this, but if you changed my name and changed my health condition and said that I was in a completely different location, you still wouldn't be able to tell whose experience it was, because it's so common. And when I told him that, he was like, okay. But I took statistics with him, like how many people have endometriosis and how many are we actually looking at in Wales of how many people have this condition. And he wrote to the then health minister to seek assurances. And again, we were going to do then an event in the Senedd together, and then COVID happened, but we've managed to do one since. So I think, again, in a long, rambly, roundabout way of answering, your MS is there to support you. So just like how Llais are, if you want to say to them, can you find out this information for me? But I think this is where the MSs are, that their job is to listen to you, but actually you can ask them, well, can you contact the health minister for me, or can you contact the health board and seek assurances of what's going on, or find out what's going on. But yeah, I mean, John Griffiths, my MS, was a huge support to me and continues to be. Actually, I see him when I'm out and about at the Senedd now, and he's remembered me and comes and checks in on me. And I think, as we said before, if you haven't had that experience when you've contacted your MS, like, look to the other regional MSs as well, or email somebody who's on the health and social care committee, or, look into those different committees and see who might be the best person to contact if you don't feel that your MS is, a good or safe person to go to.
Thank you, Dee. The next question. I'm concerned about the changes to the commissioning criteria for IVF in Wales. Do you know whether these decisions are final? And if so, when these are coming into effect? And I'm just going to add to this question just a timestamp for those watching this webinar in the future. So this question is asked in June of 2023. Emma.
Thanks, Bethan. I just want to respond to that to say you're not alone. And so many people in Wales are understandably concerned, about those proposed changes. Which were recently, just earlier on this year, quite publicised, in the media. So please don't worry and struggle about that alone. Come and see us, come and have that conversation. with this, we can provide you with that support. In relation to any developments in relation to that, Fertility Network, as a charity, we haven't heard anything officially at the moment, so we are still officially waiting to hear back from WISC, but we have contacted them. I don't know, Angela, if you will want to step in there at all. But Angela's screen has Angela's got her hand up, but I think maybe Angela might be able to answer some of those questions there as well.
Thank you. Sorry if my IT gremlins are playing up, but I am here, I am listening. Yes, so I do have an update in relation to the proposal that were made. They're on hold at the moment. So we've spoken to WISC about the concerns around that change that was proposed, and the plans are on hold. Once we know more, we will work with WISC to work through that programme, but at the moment they are very much on hold.
Thank you both. The next question then, are there any peer support networks in Wales for those unable to have children due to chronic health issues? Emma, thank you.
Hi there. Yeah, we've got lots of peer support groups here in Wales. We have, a number of different networks. We've also got online groups through Facebook, through Health Unlocked, support with staff. We've got, a moving on from treatment group and, a group called More to Life. So there are groups absolutely out there, that can support you in relation to specific conditions. Not specifically and as yet. However, we are working with Diabetes UK Cymru to look at something with them to offer, support groups for those who are diabetic, any type, of diabetic, and who are going through fertility treatment. So, we are looking at that. So if you're looking for something specific, please do get in touch with me. I'd love to hear what it is specifically that you'd like to see in specific conditions. And I'm not saying that we will be able to provide an actual peer support group, but we will certainly be able to support with signposting, and of course in relation to peer support, when it comes to fertility, we have a huge number of different peer groups and information sessions. And we are actually, Beth, and hot off the press, isn't it? We are looking to set up some walk and talk groups that are going to be set up in every health board in Wales. And those will be an opportunity to meet up, in a safe space, have a coffee and take a walk, or just sit and have a coffee if that's what you want to do as well. We can, take your lead on that, but those are going to start happening soon as well. So there's lots out there. Get in touch with either myself or Bethan, and we can provide you with more details.
Thank you, Emma. Debbie.
Yeah, so it's more or less just to echo what Em was saying there. So again, FTWW has its 24/7 online community space, and we also have heaps and heaps of condition-specific organisations and groups, including patient-led groups within our network. So if it's something that we don't know or with which we can't help, I'm sure that we'd be able to help and signpost you to relevant organisations who are focused on the particular health conditions with which you're living. So please do reach out.
Thank you, Debbie. And just to reiterate to everyone joining us tonight, or those on the webinar in the future who might not see the chat, my email address is bethan@fertilitynetworkuk.org. Email me in any of your requests, and if it's specifics for support from one of the organisations joining us tonight, let me know and I'll absolutely forward that on for you. So the next question. I'm finding my 10-year plus fertility journey to be quite lonely, and I struggle to work through and share my thoughts and feelings about my journey. Is this common? Emma?
Can you hear me okay? I think I thought I'd muted myself permanently. Yeah, yes, in answer to that, absolutely, it is common. you're not alone at all in those feelings. A fertility journey is an incredibly isolating journey to be on. I myself, was on a journey for 10 plus years also, and I struggled to talk about my thoughts and my feelings in relation to what it was that I was going through. And just like me and just like you, you know, the vast majority of people that we support here at Fertility Network do feel the same. It is very, very common and very, very normal. You know, we have lots of ways that we can provide you with some support on that journey. And we, you know, I'd more than happily, we can talk to you one-on-one if you'd prefer to not come to a peer group, or you could come to a peer group and keep your camera off and just listen. You know, that's okay as well. You know, there are lots of different ways that you can access support here at Fertility Network, but do know that, you know, if you like statistics, you know, as some people do, in a recent survey that we did with Middlesex University in London, of those surveyed, fertility patients surveyed, 83% of those people surveyed said that they felt sad and frustrated, worried or anxious often or all of the time. So that is the vast majority of people struggling. So you're not alone. It is common. We are here for you. So do get in touch and we will, you know, support you in any way that suits your needs and how best, you know, for yourself.
Emma, thank you. Dee?
I just wanted to echo that, but I wanted to also reassure that person asking that question, because obviously at FTWW we campaign and hear from lots of people living with lots of different health issues, and sometimes, you know, often fertility is a sort of integral part of their experience, but it's so common. And I think that there's often an assumption that people love talking about it or they're happy to talk about it, but like you said, Emma, there's that sadness, that anxiety, that worry. But yeah, it's so common. And I think, yeah, for fertility, it's arguably so much worse because you're striving for something that you want so desperately. And I don't think many people understand that. And I just wanted to sort of highlight again, when we're looking at society, Debbie highlighted earlier talking about society, how often when we get married, or you're going to be having kids now, then if you do have a child, when are you going to have another one? Talking about things like that at work, in the office, if somebody is saying that they're not going to have a drink when they go out, you know, with their friends, or, you know, is there something you want to tell us? There's all of these added layers of things that make it so much more difficult. And I just think this is where, again, that really essential self-care comes in as well. Please do reach out to people at Fertility Network, because as you've just heard from Emma, she's got that exact life experience herself. But I think, you know, there was the Davina documentary about contraception the other day, and I've been bombarded by people going, have you seen it? Have you seen it? And I've had to say to the people that I'm close to, and I'm obviously now broadcasting it, but I don't care, I'm an oversharer, I can't watch it until I'm in the right headspace for it. You know, during my endometriosis trials, I was put on so many different types of hormonal medication and contraception that did nothing for me. I had an incredibly traumatic experience having a coil fitted. So to sort of see that on an advert and knowing, oh, that's what they're doing, and, you know, it is really triggering. And I think triggering is an overused word, but actually for those of us who are living this 24/7, you know, we need to be able to find those ways. And you don't have to talk. As Emma said, I think if you go to, it's on your terms if you attend a support group and have your camera off. And if you decide to share something, that's on your terms. With so much of our health, we don't have control. We are in, as we've heard tonight, you're in waiting lists, uncertainty about your referral pathways, not quite sure what that doctor said in the last appointment and whether that's relevant and what's going on. You're seeing somebody else, and if you're on a fertility journey, you know, your friends just announced that they're expecting. It's all of these triggering things. So don't feel pressured that you have to talk and share your experiences, but certainly make sure that you're connecting with people as well. Like, not everyone is a professional oversharer like myself, and that's absolutely okay. But I think hopefully what those of us who do speak out publicly will do is help you know that you're not alone, and help you know that we're fighting for that change as well.
Thank you, Dee. And Laura.
Thank you. Again, just really a comment of solidarity into the feeling of loneliness and isolation that comes with the fertility journey. I really understand. I really feel what that's like. And so just to the person who put this question in, I would say really do seek out the support that you've just been told about. Because it'd be so worth it. So yeah, just a comment of solidarity, really. And yeah, that's all from me.
Thank you, Laura. We have 3 minutes left and 2 questions, which I'm really hoping to get through them all. So the first of the last 2 is not really a question, but I have just had surgery last Monday and it wasn't a great experience, and was told that I would be fit to return to work on Friday. When having to contact the GP to ask for a sick note to cover me this week, also, I felt like it was met with some resistance. So although not a question, I'm not sure if anyone on the panel had any advice. Oh, Dee, thank you.
I'll try and be really quick. Like, that's not acceptable. If you've had surgery of any description, this is again what Debbie and I speak to clinicians about, and about, you know, to policymakers. It's so often women as well, because women's health issues aren't understood, because they haven't been researched. And often, a lot of the time, if you take, for example, a laparoscopy, there's a lot of what we would say rummaging around and moving organs to have a look. And if they're removing any disease of any kind, that, you know, that's really heavy going. Then you take into account the anaesthetic, the medication. All of these different things can really, really wipe it out of you. So I think I just wanted to really remind this person around Debbie's comments around making sure, like, reasonable adjustments in the workplace. But before you get to that point, like, I know it's easy for me to say, but go back to your GP and say, I don't think that another week is going to be acceptable unless you feel it is. And remember, if you get to towards the end of that week and you're not feeling better, I say this as somebody with ME, and I got ME because I pushed through all of the time, because that was what I was conditioned to do by workplaces, by society, by everything. Please rest, please take your time to recover, because unfortunately, if you don't, it'll happen what's happened to me. Your body will choose to rest for you, and you won't have that sort of opportunity to negotiate with it. So I hope that's a little bit helpful.
Thank you, Dee. Debbie, I'm really desperate to get to last answer, so can I just give you 30 seconds? Yeah,
yes, really
thank
quick.
you.
We know it's incredibly challenging trying to get GP appointments at the moment, but by all means, you know, you can ask to see or speak to a different GP if you wish. And you may want to ask when you get through to the receptionist, you may ask, can I speak to a GP actually with a special interest, a particular interest, please, in women's health? Worth a go. And if all else fails, you know, we've got Llais here tonight, and as Angela's mentioned, one of the services they offer is advocacy, patient advocacy. So if you're really struggling, give them a ring.
Thanks, Debbie. So hopefully we've got enough time before we get cut off. If I lived in Wales, then went to England for a few months while waiting for a referral, but now back in Wales permanently, would my referral still be valid, as never told them I left it on behalf of my stepdaughter? Angela, thank you.
Yes, your referral should be valid, but if you give us a call, we can just double check that you were still on the waiting list.
Oh, Angela, thank you so much. So thank you everyone for attending, and thank you so much to our amazing panel for sharing their expertise and advice tonight. As mentioned, the webinar will be going up on our YouTube channel in the coming weeks, so if you want to watch it back, please do, and share with anyone you think will benefit. But don't forget, we're here for you. We are your charity, and our support line is open Monday to Friday, 10 till 4. So do keep in touch if you need us at all. But take care and good evening, everyone.
Thank you, Bethan.
Thank you.